is titled Amplifying Our Voice, Using Public Visibility and Open House Funding to Strengthen BPSO Awareness in Long-Term Care. What a great topic, one that is often presented to us coaches with many questions on how can we, strengthen BPO awareness and what is it that are some of the resources that we can utilize. So I'm very, very excited and pleased to introduce Laura Matthews. She is one of two managers of clinical practice for the Niagara region and brings nearly a decade of experience with the organization. Laura began her career as a registered nurse in the region's long-term care homes and transitioned into her current leadership role March of 2020. In this capacity, Laura provides strategic oversight for infection prevention control, the IPAC, falls prevention, palliative and end-of-life care, pain management, and the RNAO Best Practice Spotlight Organization program across all 7 municipal long-term care homes in her region. Wow, Laura, you are a busy, busy person, and I know Laura's even taking a break from being at a conference right now, and we really, really appreciate your time with us this afternoon, Laura, and I'm going to hand it over to you.
Thank you very much. Just going to take over here. So thank you so much for that introduction again. So the topic today is amplifying our voice using public visibility and open house funding to strengthen our BPSO awareness in the long-term care homes. So just to start, I wanted to give an overview of just the Niagara region in our long-term care homes. So we do oversee 7 municipally run homes from across Niagara, from Grimsby to Port Colborne. Across the 7 homes, we care for a total of 956 residents, and we are currently in the process of redeveloping one of our sites, which is Lynnhaven in St. Catharines, which will allow us to provide additional care to another 12 residents. We're hoping to open sometime this year, so fingers crossed for us. So something that we do as part of our BPSO program is make sure we have an executive structure in place for the Niagara region when we submit these reports. So this is just an overview of kind of what it looks like from top down. So our executive sponsor is our director for senior services, and our corporate project lead is Alexis Lamson. Without the support from the top level, we would not be as successful in implementing additional best practice guidelines and clinical pathways. Our director and associate director ensures that the BPSO program is embedded within our organizational priorities and operational plans. We also have 3 BPSO implementation leads at the corporate level. So it'd be myself, Rana Perrin. She will be retiring shortly. So unfortunately, not for very long that she'll be as one of our BPSO implementation leads. And then also Romancia Austin, who is our other manager of clinical practice. So we support projects from the corporate level to ensure that there's continuity between the 7 long-term care homes. From there, we have home level project leads. So these are typically dependent on the work being implemented, but formally they are our nursing managers. So if it's a larger home, it'd be the associate director of resident care. And for some of the smaller homes where they don't have an ADRC, it would just be the director of resident care. As well, our clinical documentation and informatics leads, or RI coordinators, are integral in ensuring successful implementation of quality improvement projects. We're also lucky to have 3 continuous quality improvement advisors, or CQI advisors, who work between our 7 homes, and they're also influential in bring towards change ideas forward into fruition. Without the support from everyone involved, we would not have the success in various projects we have implemented. So just a little bit about our BPSO journey. So we began the BPSO program in 2016. This is also when I happened to start at the Niagara region, so very fitting. And we implemented the foundational BPGs at this time, which were person and family-centered care, preventing abuse and neglect, and nursing leadership. From 2016 to 2020, best practice guidelines were being implemented at each long-term care home individually with little oversight corporately. During these years, they implemented pain, cultural diversity, and stage 1 to 4 pressure ulcers. In 2020 to 2021 is when I began working at our central support or corporate location in my current role. This is when it was decided that we should be moving the implementation of BPSO program to the central support level so that we can have that continuous oversight across the 7 homes. 2020 is also when we were dealing with a lovely pandemic. Despite there being a pandemic, we didn't stop with our implementation guides for BPSO. We still implemented the fall's best practice guideline across 3 of our homes and then fully implemented it in 2021. We saw that there was a need to continue to implement best practice guidelines despite there being a pandemic in place. From 2022 to 2023, we began the process of the RNAO clinical pathways. We are in cohort 2. We began with the admission assessment, delirium, and RFCC clinical pathways. During this timeframe, we also were implementing the oral health best practice guideline. From 2024, we implemented and refreshed existing best practice guidelines for falls and pain, and also implemented the opioid clinical pathway with the RNAO clinical pathways. That year, we also were able to implement the assessment and care for adults at risk of suicidal ideation and behavior best practice guideline in collaboration with our local public health unit. And then in 2025, we launched the palliative and end-of-life clinical pathways and began the process of implementing the care transitions best practice guideline. As of this year for 2026, we are looking at implementing additional clinical pathways as they become available and continue to complete annual gap analyses of existing best practice guidelines and pathways to ensure that we're not missing key processes. So like I mentioned, we started in 2016, so it is 10 years of us being a best practice spotlight organization. So we plan to have activities hosted at each of our long-term care homes and to celebrate this anniversary at our senior showcase next month at our headquarters. So when we talk about best practices, it's not enough for them to exist on paper. They need to be seen, understood, and valued in everyday care. By increasing awareness, we start to see a shift. Staff become more engaged, families feel more confident in the care being provided, and there's a stronger sense of pride across the organization. This funding gave us the chance to move best practice spotlight organization from concept to something tangible and visible in our homes. We were successful in obtaining 2 funding opportunities from the RNAO last year, one being for public visibility and the other for open house funding. Our goals were to increase awareness of the BPSO program across our staff, our division, and our community, and then showcase this pride in being a BPSO. Our goals were straightforward but meaningful. We wanted to make BPSO visible across all 7 homes, not just in pockets. We aimed to make best practices feel approachable, not overwhelming or abstract. Engagement was key, and that meant reaching not just staff, but also residents, families, and visitors. Most importantly, we focus on building something sustainable, awareness that continues rather than a one-time initiative. To do that, we focused on a few core elements. First was visibility, making sure people could actually see BPSO in action. Second was interaction, creating opportunities for people to engage, not to just observe. Third was celebrating our champions because they bring this work to life. Without champions, we'd have very minimal sustainability in our practices. And then finally, consistency across all 7 homes so that the message felt unified and intentional. We recognized early that one message doesn't fit everyone. Frontline staff, leaders, champions, families, and community partners all connect with information differently. So we tailored our approach, making sure each group received messaging in a way that resonated with their role and their relationship to care. With the public visibility grant, we were able to have our comms department develop professional team's background, which is what I'm using right now, and also as our BPSO slides that I'm using today. So these were used for external meetings held virtually. We also created and provided to our staff champion t-shirts so that they could proudly wear their shirts to work to acknowledge the amazing work that they do in their role as a champion. We're able to have our comms department develop videos for internal and external use to increase awareness of the BPSO program and to entice other staff, residents, and visitors to investigate becoming a BPSO champion. The most successful and memorable thing that we did use our public visibility grant for was cookies. They were definitely something that staff have been asking for this year as well. So we'll see if we have that in the budget this year. A big part of this work was elevating our best practice champions. So again, simple things like branded t-shirts help make them visible and approachable. We also use internal communications and videos to highlight their role and to recruit others. Over time, this helped to shift the perception from champions being seen as additional work or extra work that they had to do on top of their already busy workload to being recognized as leaders and influencers in practice. So we try to develop champions in specific topics that they're interested in, not just an overview of everything. If they like falls, they'll be a falls champion, like skin and wound. We get them to be skin and wound champions. If they're already kind of doing that in their role, we just acknowledge that you should be a champion because you're already doing the work. Why not just add a t-shirt on top of that? So this is some of the examples that we had for our internal and external showcasing of the public visibility and open house funding. So we do have an internal communication app with our staff. So we're able to post information on that application, which included the video that we'll be showing, I think, on the next slide. The cookies are on the slide there as well. And then on our public Facebook page, we're able to have an additional video that was shared to the public to make them aware of just the Niagara region being a best practice spotlight organization over Nurses Week. So this is our video that we had developed from comms that was showcasing our BPSO program in general, and then was also at our senior showcase. So we had our previous BPSO coach Ulrike there, and then our current coach Amon. I'll just play the video. So that was our video that we created for the BPSO program to entice our staff to reach out to become champions. I surprisingly actually did receive a few emails from staff. I didn't think I would. Afterwards, when we posted on the internal communication app for our staff, they did reach out saying that they wanted to become champions. So they did the online BPSO champion program and then were designated as a champion following that. And then we continue to do additional champion training at the home level too. So we also had the open house funding that we were able to obtain last year. So this created opportunities we wouldn't have had otherwise been able to complete. It allowed us to engage beyond our homes, bringing in other departments and even regional council. So in that video, we did have regional council come to the senior showcase, and they're able to ask questions about BPSO and see kind of what it is, what it means for the residents that we care for. It became a platform to showcase the incredible work happening across all 7 homes and to build broader awareness and support. So at the open house that we did have last year, which we were doing again this year in a couple of weeks, it was held at our headquarters in Thorold during regular business hours. We had booths across the different divisions for senior services and community programs. So we did have the BPSO booth, point of care testing, nutritional services, rec, clinical documentation, resident family support, redevelopment, resident council, and seniors community programs. So they had different booths to highlight the good work or great work that they're doing across the organization so that we can share that with, again, counselors and the people who really make the budget for us as well. So highlighting all the great stuff that we're doing at the Niagara region for senior services. We saw a noticeable shift in staff engagement. There was more curiosity. People were asking questions, wanting to learn more about best practice guidelines and what it meant to be a champion. And importantly, there was a stronger sense of shared purpose developing across the teams as a result of the videos that we had put out, and then also having that increased awareness at the home level. So champions identified their preferred best practice or clinical pathway to assist with dissemination. We track the names of staff who typically are asked to assist with dissemination. So those are typically our resource nurses and CQI leads. We provide training centrally, which is then disseminated by the champion with the CQI lead as the home level support. Most recently, we facilitate a refresh on the FALLS program for our RNs and RPNs and PSWs, which was provided to resource nurses who acted as the champions, and then some other identified staff as well, which included PSWs. And then they were able to disseminate this information across the majority of staff, that being on day, evening, and night shift. When a new best practice guideline is being implemented, we ask for staff to volunteer if they're interested in the best practice guideline, as this helps with dissemination and creating new and exciting ideas for how to increase engagement across other staff as well. So we approached measurement in a practical way. We looked at attendance at engagement during open house, gathered information or informal feedback from staff and families, and observed increased visibility of BPSO in our environments. We also saw growth in champion confidence and participation, which is a key indicator of sustainability. One of the biggest benefits of the funding was the ability to think long term. We created materials that can be reused and developed templates for future events. This wasn't about a single moment, it was about building momentum that we can continue to grow. So, like the background I have, it can be used continuously. The ones we use for our PowerPoints all have the BPSO logo on them. And the event that we had last year, we can reuse some of those materials again for this year. We continue to integrate BPSO into daily operations. Now that when they walk into the homes, they'll see designation posters more prominently at the entrances. Something that we noticed when we went through accreditation is that a lot of the BPSO designation posters were kind of hidden away. So we made sure that those are up at the forefront once you walked into the home. Champions continue to wear their t-shirts throughout the year, not just at special events. And BPSO is being reinforced during orientation, annual education, and ongoing learning opportunities. Few key lessons stood out. Keeping messaging simple, clarity matters. Leading with visuals, they capture attention quickly. Empowering champions to tell the story, they make it real. We don't want them just to hear from me saying it's great. We want the home level and the frontline staff to provide their input, because peer to peer, they're going to more likely listen to them and understand why it's important. And then always connect best practices back to everyday care where it matters most, always directing it back to it's for the residents' benefit, and that typically helps with our staff. So champions are truly the link between evidence and practice. The funding helped amplify their impact by increasing their visibility and reinforcing their value. And when people feel recognized, engagement naturally grows. So they were doing a lot of the work before, but then just being acknowledged that they're doing additional work on top of the regular workload before even being designated as a champion, but then giving them that designation made them feel like they're being valued for the additional work that they put into the day-to-day practice that they provide for our residents. So looking ahead, the work is not stopping here. We're looking at expanding engagement beyond events and embedding and continuing to embed BPSO into key areas like orientation and quality improvement work. The goal is to keep providing or building pride in delivering evidence-based care. Some key takeaways for you to remember is that funding creates opportunity, but it's what you do with it that matters. So you could get the funding grants, but it all depends on if you're using it in the most beneficial way for your organization, whether your idea or your objective is to get more visibility or to, again, enhance the program and acknowledge the champions. It all depends on how you're using that money. That will be the most important. Visibility drives engagement. So again, making sure that people are aware that we even have this program in place. Sometimes when I'd ask new hires or existing staff, they knew what BPSO meant. They had no idea. So just making sure we're very visible and continuously to remind people that we are a BPSO, because it is a lot of work that goes into it. And it's very beneficial to our residents and to our staff as well. Champions make the practice real, so they bring best practices to life. Again, without them, we're not doing anything. It's hard to try and do something from a corporate level. We need people on the front line to be able to make sure those practices remain in place. And then even small investments, when done thoughtfully, can lead to lasting impact. And thank you. So I want to thank again RNAO and our BPSO and clinical pathway coaches. They're amazing. They help us out so much. And again, special thanks to our BPSO champions who make it what we do so impactful to our residents. We really appreciate all the work that they do for our residents.
Wow, thank you so much, Laura. You really provided such amazing information, resources, and great ideas from t-shirts to cookies and your beautiful background here for your slides that can be reused, as you mentioned. The video from comms, kudos to your comms team. That was an amazing video. And for those who participated in that, um, really great ideas. I'm sure there was lots of meetings on brainstorming, and I think you nailed it. And I love so many quotes that you had mentioned. I'd like to say visibility drives engagement. That is so crucial, right? You know, BPSO, there's a lot of work that goes into being a BPSO, and then just how you're really looking to drive that engagement and using public visibility for that. And another favorite quote was champions bridge between evidence and practice. And that's so true. So thank you so much. And Laura would like to open it up to questions here. So